Hi, everybody, and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about Passionflower, which is, well, it is a flower, but it's also used as a supplement, and how this may or may not benefit you in your mental health. So listen up to find out more. So what exactly is Passionflower? Passionflower is known by many names. It is also known as a maypop, purple passionflower, true passionflower, wild apricot, and wild passive vine. Passionflower is a purple flower plant that also grows small green fruit that look like a lime. Passionflower grows in the southeastern United States. It also grows in Central and South America. Passionflower has been added to over-the-counter sleep aids for many years and may be found in a lot of popular brands. The purpose of this video is to explore the use of passionflower to treat anxiety specifically, not necessarily sleep. Although if you have less anxiety, it can be easier to sleep. Let's talk a little bit about the history of passionflower. Traditionally, passionflower has been used to treat a variety of conditions. It has been used as an antioxidant, anti-inflammatory, antimicrobial, antitussive, which means it helps with a cough, anxiolytic, helps with anxiety and relaxation, and it's also been used for diabetes and menopause. So it was discovered and officially named when the Spanish began to settle in Central America. How does passionflower work? Or how do we think it works? Passionflower has many potential mechanisms for treating anxiety. The active ingredients inside passionflower include flavonoids, maltol, cyanogenic glycosides, and harmon-indole alkaloids. Some of the alkaloids isolated in passionflower resemble the structure of benzodiazepine medications, so that would be medications like your Xanax or your Ativan or your Klonopin. So this may be the primary mechanism of the action behind passionflower's use for anxiety and insomnia. So what is the evidence for use of passionflower in this manner? And I'm going to go through a couple of articles, and article number 1 concludes, and all these will be in the full article found on our website, and it will go through all the links and the sources that I used for this. So the first article concludes that the study noted that passionflower might be suitable as an add-on treatment of generalized anxiety disorder with low side effects. And then they also said further studies with longer duration are recommended to confirm the results of the study. Okay, and then another article concludes random controlled trials examining the effectiveness of Passionflower or Passionflower for anxiety are too few in number to permit any conclusions to be drawn. Random controlled trials with larger samples that compare the effectiveness of Passionflower with placebo and other types of medicine, including antidepressants, are needed. They need more studies, is what they're saying. Another article concludes, in outpatient surgery, administration of oral Passionflower incarnata, or passionflower, as a pre-medication reduces anxiety without inducing sedation. That's positive there, just meaning that it will relieve anxiety or can relieve anxiety without making you feel sedated. Okay, another article concludes that passionflower showed an anxiolytic effect similar to midazolam, which is a benzodiazepine, and was safe and effective for conscious sedation in adult patients who underwent extraction of the mandibular third molars. So this was kind of a special case study in a dental situation, but they found that to be effective. Okay, article number 5 concludes that passionflower showed a similar effect to midazolam but differed from placebo and belungu, which is another substance they used during the study, which were unable to control anxiety in the situation. Therefore, the results suggest that Passionflower configures an herbal medicine and with an anxiolytic effect, adequate to use in third molar extraction. So again, this one was done, I think, by the same people in a dental situation. Okay, so what are possible side effects that maybe you could have when taking passionflower? They include nausea and vomiting, dizziness, confusion, ataxia, which means loss of complete control over your body movements, and drowsiness have been identified with passionflower usage. Prolongation of the QT interval and episodes of ventricular tachycardia have also been reported. So if you don't know what those things are, they are some heart abnormalities that we want to avoid. Now, a lot of this stuff I believe happens at the higher doses. So like the doses you get in your sleep aids at Walgreens or whatever doesn't have enough to create these kind of side effects. Maybe a little nausea, maybe a little dizziness, but nothing like VTAC or the prolonged QT interval. Okay, so how do you dose Passionflower in the treatment of anxiety? The dosing information that I found says that you should take 500 milligrams to 2 grams for mild sedation and take it every 6 to 8 hours. So this can be similarly used for anxiety. So smaller doses, around 90 milligrams, have also been used in the treatment of anxiety. So you can go as low as 90 up to 2 grams. And as with all supplementations, it is wise to start low and raise the dose slowly over time. So what are some positives or pros of Passionflower? Number 1, it's cheap. Number 2, it's easy to obtain. Number 3, it has a moderate amount of evidence behind its use, and it has minimal side effects. Pretty much, if you want to give it a try, go find a quality supplement, buy it, give it a go, and see how it affects you. So what are some negatives or cons of Passionflower use? It doesn't have the strongest evidence. So as you can see, some of these are like in dental situations. We don't have a lot of like broad studies that involve a lot of people using this for anxiety who like have failed other medications. And so there's not a ton of evidence here. It may not work for clinical level anxiety. Maybe this works for just somebody who's had a stressful day and needs some help falling asleep at night. But if you have clinical anxiety, panic attacks, generalized anxiety disorder, PTSD, those kind of things, this probably is not going to be able to help you very much, but maybe. And quality supplements may also be hard to find, as with all supplementations. What is the anxious resistance overall take of Passionflower? Passionflower is a safe supplement that is readily available. It is something that has moderate evidence behind it, but no backing from any psychiatric associations. It has been used traditionally, and traditional wisdom may indicate its use in treating anxiety or insomnia. Since Passionflower is typically well tolerated, it may be something simple to try. Try starting the dosage low and gauge how your body is feeling. If you are getting desired effects on a low dose, then you don't have a need to increase it. If you're not having any side effects on a low dose, you can increase it a little bit and see if you start to get some of those anxiolytic effects. Dosages exceeding 10 milligrams per day may be too much, so that may be toxic. Please do not take more than 10 grams, okay? Stick to the 2 gram limit is probably your best bet. And also with all supplements, it's wise to consult your prescriber before taking it. Make sure there's no interactions with any other medications that you're taking. So overall, Passionflower may be a good option for those with subclinical anxiety and may even be effective at higher doses for clinical anxiety. It just depends. But this is a fairly safe supplement and maybe something that you might want to try. Thank you so much for watching this video. If you enjoyed it, please like it. Follow us and subscribe to us for more. We cover all things mental health, anxiety, depression, and everything you need to know. So thank you so much for watching.